A really common question I get is if ultrasounds are safe, ultrasounds during pregnancy. So an ultrasound, it essentially uses high frequency sound waves to see inside the body. It's really important to know that an ultrasound does not expose you to ionizing radiation like an X-ray does. So it is so much safer than an X-ray. They're really not equivalent. The primary potential risk of an ultrasound is that it can slightly heat tissues. So because of this, it's recommended that women only receive ultrasounds when they're medically necessary. So a lot of times care providers recommend an ultrasound around 9 weeks, maybe earlier, to confirm the baby's heartbeat, that it's a viable pregnancy. There is typically an ultrasound around 20 weeks gestation, which allows the medical care specialist to look at the anatomy of the baby, help to confirm that there are no defects, to make sure the baby's healthy as much as we can tell through an ultrasound. Sometimes around 12 weeks, some care providers recommend what's called a nuchal translucency test. And this is an ultrasound that looks at the space behind baby's neck. And this is something that can help to determine if the baby is at risk for Downs. And of course, women that have special circumstances, they might need additional ultrasounds for various reasons. Sometimes when a woman goes past her due date, the care provider recommends an ultrasound to check to see, how much amniotic fluid is in the uterus. So there's different circumstances that would make it reasonable to have another ultrasound. The main thing that you want to avoid is just simply an ultrasound just to look inside and take pictures of the baby. Those really aren't needed. The other ultrasounds that I mentioned that were for medical reasons, typically the benefits of those ultrasounds outweigh the small risk of, again, the heated tissue. But you don't want to just say yeah, I want another ultrasound just because, and I'm going to go get that. It's really best to, again, only get it when it's medically necessary. It's also really important that the ultrasound only lasts as long as it needs to, which is why you only want a trained professional to do an ultrasound. It is really not advised that people try to find an at-home ultrasound kit. Not encouraged. It is a fine art to utilize, the ultrasound technology, and you really need, again, a trained professional to do it. So the gist of this is that while there is, a small risk posed by ultrasounds, it's not huge, and they're typically, a great benefit for a pregnancy if they're done when medically necessary. So if you have any questions about this, let me know in the comments below.